Welcome back to Beyond Your Diagnosis, part 3. We're talking all about shoulder impingement. This is one of those classic BS diagnoses that for some reason is still thrown around, even though research has dismantled it time and time again. Similar to the SI joint dysfunction. Historically, it meant that the rotator cuff tendons or subacromial bursa, which all live in here, were being pinched between your humeral head. So this is your humerus. Then you have a ball here, ball and socket joint. Your humeral head and your acromion, okay? So historically, it's been thought, okay, the rotator cuff or the subacromial bursa are being pinched between those structures. Some dude named Neer coined this term impingement in the 1970s to describe shoulder pain when you raise your arm overhead. Now, what's really funny is that the special tests for shoulder impingement, they're called Neer's and Hawkins-Kennedy. But when you do these tests, like, they're problematic because, when you put your shoulder in this position, you're going to feel some kind of pinching. When you put your shoulder in this position, you're going to feel some kind of pinching because the joint literally has nowhere else to go. So this term impingement makes people feel like something is stuck, something is pinched, something is damaged. And so if we keep moving it, we're going to keep worsening, right? So this feeds into fear avoidance, which is exactly what we don't want, right? So instead, what we need to do is talk about where the pain really comes from. Because what often happens too is there's this fear around, oh, well, something's pinching, something's being damaged, something's torn, so we need surgery, right? We need to fix the joint. But there's been so many randomized controlled trials, which is one of the most, one of the best types of research studies that you can do, one of the most reliable ones, that have tested a real subacromial decompression where you're releasing that part of that joint and opening up space, and a fake one. And they get the same exact outcomes. So it's not really about pinching. Where the pain really comes from is how the system is handling stress. Because tendons, especially your rotator cuff muscle and your biceps tendon, so your biceps tendon actually comes up here. They become sensitive from overload or poor recovery. Where have we heard this before? Here's that concept of load versus capacity again. I wonder if it's important and plays any type of role in pain and injury. Where the pain can also come from is not enough upward rotation or posterior tilting of your shoulder blade. So we have opportunity here, right, to improve the control at our shoulder. Or not enough thoracic extension can reduce the space or alter load sharing. Any kind of weakness or imbalance in the rotator cuff, in the shoulder blades, or the posterior chain can change how force is absorbed through that joint. So what we can do instead, shoulder impingement is an outdated, non-specific diagnosis. There's no reliable test for it. There's no strong evidence that it even exists as described. And surgery targeting it doesn't help. So your shoulder doesn't hurt because your bones are pinching your tendons. Your shoulder likely hurts because the tissues have been overloaded and are sensitized. The joint is strong and stable. So we need to give it more load, more control, so that we can rebuild its capacity. So really, shoulder pain is better understood as more of like a tendon or capacity or movement issue. So again, like I've been giving you in these videos, I'm going to give you 3 exercises that you can do to help reduce the anterior shoulder pain that you're feeling. First one is going to be an exercise for the rotator cuff. We're going to do external rotation. You could do it with a band or with a dumbbell. We're also going to do a slow controlled push-up to down dog and a cat-cow. Like always, I'm going to give you the sets, the reps, the dosage for per week, and the pain levels we should be experiencing. So again, discomfort, 3 to 4 out of 10. Totally cool. We want to experience a little bit of discomfort, but not push it so far that we do risk continuing to overload the tissues. We need to slowly build, and we do that through a little bit of discomfort, not too much. And it would be best if you could do these exercises 3 times per week. First one is a side lying external rotation. I do not have a small dumbbell at my house. We have an adjustable kettlebell and adjustable dumbbells. My adjustable dumbbells are too heavy for me to do this exercise. Side lying external rotation, you should be using really, really lightweight. So I'm going to use my resistance band, and I'm going to have to face this way for you. So you're laying on your side, your elbow gets tucked. Kind of think of like your hip bone and your side are creating a little nook for your elbow to sit. So you create that nook, and then you bring your hand all the way down to the ground, keeping your elbow should not bump up like this. Elbow stays in the nook. And then you're going to slowly raise up and slowly lower down. I like a count of 3 for each. So 1, 2, 3, 1, 2, 3. 1, 2, 3, 1, 2, 3. Notice how my arm did not move a ton, right? We're just doing that slow, controlled motion. You're not going to see a ton of movement because your rotator cuff muscles are really small and they're really deep in there. So we're not going to see a ton of movement here. Okay? So for that exercise, I like 12 to 15 reps, 3 to 4 sets. Now we're going to do the push up to down dog. Now, when you're pushing up, you need to make sure that you're watching that your shoulders aren't dumping forward, right? Yes, I'm 40 weeks pregnant and I can still do a freaking push-up. I did 10 the other day. So, we're here. Again, engaging the core. We're slowly lowering down, pressing up, and pushing back into a down dog. When you do the pushback, you want to think about driving the heel of your hand into the ground. So you're kind of like pushing away like this is what you should be imagining. What that's going to do is recruit the shoulder blade muscles, specifically the serratus anterior, which helps with shoulder protraction to help build more stability there. For these, you're going to do 8 to 10 reps. If you can't do a full push-up, then you could do these incline. You could, this might be a little too high, but maybe you have a chair that's here, and you can still get the same idea with the shoulder blade muscles, as well as the push-up part is important because we do still want to work the upper body. And when you're going down, thinking about also squeezing your shoulder blades. So again, we're getting that good shoulder position and not like dumping forward like this, right? We're retracting the shoulder blades, pushing away, and then up. And then the last one's a cat-cow, because again, we want to make sure that we're accounting for thoracic extension. And this is like a double whammy, because when we do cat-cows, when we push away, we can also get some of that serratus anterior lower trap action going. So I like to take this segment by segment. You are going to start by tucking the tailbone, arching the low back, arching the mid back, pushing the ground away from you, tucking the chin. Then you're going to arch the pelvis, the low back, the mid back, shoulder blades down, reach up, then reverse. Nice and slow and controlled. That is what wins the race. I even get some pops in my thoracic spine there. So, did I talk dosage for the push-ups? 8 to 10 reps. Oh, and then I said you could change position. And I would do 3 to 4 sets. And then cat-cows, I would do 10 to 15 reps, 4 to 5 sets. And again, 3 times per week should take you 10 to 15 minutes. If you can't dedicate 10 to 15 minutes 3 times a week, it's like 45 minutes a week to heal your pain. I don't know what to tell you. And as always, remember, recovery is important. You can't just do these exercises and hope. You'll feel better if you just do these, because doing this is better than nothing. But they are highly more effective if your nutrition, your hydration, and your sleep is on point. See you in the next one.